Hello, good morning. How are you guys doing? You had a nice night, all of you? Yeah. Jay, you didn't have. Jay, right? Okay. So today we'll be talking about a very interesting thing that's right to love and right to procreate and right to reproduce and bring in this world a part of you. And I'll be also touching about the sexual and reproductive health of queer persons and touching upon areas which are generally not discussed either in the communities conversations on health or even in the medical setup. So it's going to be a little educative also, since there are so many community members, and I want to also use this opportunity that this message then further spreads into the communities, especially those who are not that privileged with the medical knowledge. Mihir, can we have the next one? Yeah. So I want to start with this very powerful statement, which I read, that the desire to have children is not attached to gender. It's not even attached to sex. It's just being part of a human being, and I wouldn't say it's not just human being. Even animals and other species want to have children or whatever you call it. So when, however, we have conversations about gender identity or sexual orientation, and with reference to the trans or queer communities, reproduction is something which is which always takes the backseat, because it's considered that gay persons won't have children, or trans people तो उनको तो बच्चे कैसे हो सकते हैं, वो तो बच्चे किडनैप करते हैं. So that's the conversation which the mainstream society has generally. Next one. So when it comes to the queer and trans bodies, we are generally mysteries. So we are either converted into very divine beings, just like how disabled persons are now Divyang Jan. Divyang Jan, right? Is that the word that a prime minister has used? And sometimes you are subhuman, you know. So many times doctors, including, consider that trans and queer persons are asexual. That trans people, how can they have sex? I mean, aren't their genitalia not fashioned in such a way that they can't have the penetrative sex, right? And therefore they are non-reproductive. So even when we look at the Transgender Persons Protection of Rights Act, it's completely silent on the issue of marriage, surrogacy, adoption, having children, rights of children. It only talks about custody, so that's the kind of language which the law is using. On the other hand, we sometimes see that the trans bodies and intersex bodies and queer bodies are considered to be hypersexual, to the extent that we start using the word perversion. So if you look at the forensic medicine and toxicology textbooks, and look at the descriptions of lesbian and gay persons over there, they would be considered to be hypersexual perverts, and those are the kind of words that have been used. And it's like some kind of a psychological derangement, and that is the kind of perception you have. So if you come out in a medical school and say that you are a trans person, you will be assumed to be a pervert, and other people will stay away from you, because that's the language which is there in the textbook, which they are supposed to remember and then say that to their examiners to score marks and pass and become good doctors. And I specifically mentioned two acts over here, the NSCP and the Trans Act, which basically reduce us to our bodies. Even in the National AIDS Control Program, it's been the pioneer when it comes to the dialogue around trans persons, and that's the first time any government body started speaking about MSM and trans persons. But then what is the context? The context is HIV. Everywhere you look at the NACO documents, it says that MSM and trans people are the ones who have the highest prevalence of HIV, sometimes touching 50%. And I think, as Sayan was mentioning yesterday, once you say that someone is HIV positive, it's assumed that they are sexually active, and not just sexually active but are having multiple sexual partners and unprotected sex. They are irresponsible, they do not know how to take care of themselves, and these are the kind of judgments which come with the diagnosis of HIV. So when you are saying that a particular community has one of the highest prevalence of HIV, you are also painting that community as someone which is hypersexual, sexually irresponsible, not capable of making decisions, and therefore needs disciplining. When we come to the Trans Act, it is also reducing us to our bodies. So to be a male or a female, and get that certificate, you have to undergo some kind of a surgical intervention. Without that, you can't be a male and female. I sometimes wonder, if a woman undergoes mastectomy or hysterectomy, will you take away the woman's certificate which was issued to her at birth, because she does not have a uterus and breast which you want a trans woman to have before you can issue her women's identity card? Or if a man has testicular cancer and gets the testis removed, he no longer continues to be a man. Will the marriage be dissolved? I mean, these are the kind of questions that we really need to ask these lawmakers. So it's all reducing us to our bodies, and not even talking of sex and reproduction in the same acts. Next one, Mihir. When it comes to the intersex bodies, though we are talking about mostly trans persons in this conference, I mean, let's not forget about the intersex persons, which are a very invisible part of our community, and which unfortunately has been clubbed with the transgender persons in the Trans Act. So when we legally speak about transgender persons in India, it includes trans persons and also intersex persons. And in the intersex persons, there has been this constant question of what is normal. Just to give an example, what is the normal length of penis and what is the normal length of clitoris is the question that the doctors are, dealing with. And if a clitoris is long, then how long is the clitoris, and then you cut it so that it becomes normal. So these are the questions that the intersex bodies face, and the consequences are that then the parents and the doctors decide to have unnecessary surgeries on intersex children, which can scar them for lives. We talk so much about female genital mutilation being practiced by in the African communities, but we don't talk about the genital mutilating surgeries which are being performed in the disguise of helping these intersex children by their own parents and caring doctors. So when it comes to the intersex persons, a very important question is who decides what will be the body of this intersex person, and what is this normal body where you want to fix in, because the parents want to avoid that discomfort of telling people that as soon as you hear good news, कि किसी को बच्चा हुआ, you ask क्या हुआ, लड़का हुआ या लड़की. So I've made this principle that now anyone, they tell me that they've been blessed with a child, I just ask them if the child is healthy, if the mother and if the child is doing good. But stop asking whether it's a male child or a female child, did you get a boy or a girl. That puts the pressure on the parents to tell the society, to get a birth certificate, because currently our birth certificates do not have the provision of writing intersex in it. In the schools, there is no provision of writing intersex. The only option available is transgender, and intersex children are not necessarily transgender, and you don't know if they are transgender at the age of 3 years. I mean, they may be still exploring and discovering their gender identity at that time. So it's very important that we have this dialogue and conversation on who decides. Do the parents have the right to decide and perform these surgeries on the children? Do the doctors have the right to decide whether this child should be reared as a male child or as a female child? Or should we wait for the child to grow up, discover their gender identity, and then in the long run, maybe when they're able to take that decision, or maybe even wait till 18 years if it's not a life-threatening condition, and then let them decide what kind of a body they want. Why do the parents have that right? No, they don't. Parents are not Bhagwan. Let's get away from that concept for once and all. They have the right to give consent when it is for the betterment of the children and for the care of the children when the children are diseased. But intersex children are not people with disease, and therefore it's not a consent for a procedure which is going to cure or care for the child. It's a cosmetic surgery that you're getting performed so that you can declare that you have a boy or a girl, and most often people convert the intersex children into boys because that's going to be the chirag of the khandan, right? Next one. When it comes to the trans and the intersex persons, this is a very important confabulation which happens, and we need to understand that there are different needs. In the trans communities, we have been fighting for allowing providing care to trans adolescents and children, to give them puberty blockers or puberty delayers so that they can take their time and delay their puberty and later on decide whether they want to undergo transition or they want to continue with their natural puberty process. Unfortunately, it is not allowed in India right now, administering puberty blockers to transgender children. But at the same time, we need to understand that while this is something which is going to help trans children take decision later, the procedures that we do on intersex children without their consent are permanent, and they can be life-threatening also. That they can permanently mutilate and therefore take away from them the joy and pleasure of having sex later, for example. So these are two important things, that when we are dealing with the trans children, it's about their life. It's very important to do that. And when it comes to the intersex children, the principal should be taking a back step and allowing the child to decide. And the medical community needs to come to terms with that. That when it comes to trans children, help them through puberty blockers. When it comes to intersex children, no intervention is the best intervention unless it's life-threatening, which is very rare. Next, please. Now, this is something which most of us have been talking about since yesterday, but I just wanted to highlight that this denial of reproductive rights in our laws, and I'm sure my other panelists will be speaking more on it. So marriage, adoption, surrogacy, ART, MTP, these are the things where our rights are not there. But one important point which generally does not become part of a conversation is cancer screenings. Cancer is the second most deadly disease that we Indians deal with. And screening could be a way of decreasing mortality, improving your quality of life. But this has been denied to trans persons officially because none of our national guidelines on cancer screening talk about trans or intersex or gender non-binary persons. Next one. So I'll be just highlighting. So yesterday Swati was saying that the marriage provisions, does not speak about biological man or woman. But this is coming from the court statement from the highest legal representative of the government, who mentioned that the marriage is permissible only between biological man and woman. And therefore, this fight becomes now even more difficult when it comes to marriage between a trans person or between the same-sex couples. Next one, I'll quickly go through these ones. When it comes to the abortion laws, it always uses the word woman. And I think Umi was mentioning this, that now with the Trans Act, you can easily get the transgender identity card. But if you want to get the woman's card, which was easier before the Trans Act, now you have to undergo a surgical procedure for it. I myself have not undergone bottom surgery, but I have a woman's identity card on all my markers because this was before the Trans Act. And I'm so fortunate. Had that been later, now I would have to prove to the magistrate that I've undergone surgery, and if it satisfies him, her or them, only then I'll get that identity card. Next. When it comes to the surrogacy and assisted reproductive technology legislations, and the bills have been passed in both the houses 3 days back, and we are sure the president is going to sign on it. So it talks about a couple which is a legally married Indian man and woman. Previously, single people could also commission surrogacy. So you have the famous example of Karan Johar, who commissioned surrogacy, but now it's not possible for him because only it has to be a married couple who has been infertile for 5 years, and only then they can. And it's a very ageist document. All of these places, the elder people beyond the age of 55 or 60 are not allowed to even commission surrogacy. Next. We have the assisted reproductive technology, which says that the person using that technology has to be a couple, married man and woman, or has to be a woman. So single men are not allowed to use assisted reproductive technologies, and it's not allowed for the live-in couples who the court says have the same rights as the married couples in other things. And I'm specifically mentioned this statement which came from Dr. Hina Gavit, Member of Parliament, and the rationale given for why men are not allowed to commission surrogacy. So she mentions that in 2017 law says that single men can't adopt female child, which is the provision in your adoption guidelines. And this was done in consideration to a significant number of female children being exploited by them. I don't know where is the data that adoptive male parents exploit their daughters, and it's assuming that all the adoptive parents are cis-het men. I mean, what if the adoptive parent is a gay man and then adopts a male child? Can they also potentially exploit that child? And then it says that since determining the sex of the child is not legal in India, even when you are commissioning ART, this makes single men ineligible because then they can't choose only a male child. I mean, what if that turns out to be a female child? Then they can't have that child, and therefore we'll deny them the rights of having a child of their own. Next one. When it comes to the adoption, this is terrible that the legally eligible children for adoption are very few in India. That's one of the countries where there is actually a genuine need for a lot of adoption, and it says that it has to be a couple or a single female when it comes to adopting any gender, and males can adopt only, and it's very difficult for a single male to be approved for adoption. And this is something very interesting, and I want to talk about it, that to become an adoptive parent, you have to prove that you can be a good parent. Why is that not the condition for the other parents, who have their own biological children? Why don't we ask them that you please get a certificate of your mental, physical, emotional fitness before you can conceive? We never ask that, and nowadays people are suing their parents for having them. I'm sure you have heard of that, right? But here, when it comes to adoption, you have to prove that you can be a good parent. When it comes to having your own children, well, you can be a monster and have your own children. Next, please. So coming to the healthcare provisions, again, this is a conversation that we have been having for long as to what are the difficulties that trans, intersex, queer persons have in the medical system, what are the reasons for that, what are the barriers, and while many of us have had very bad experiences, including myself, with the healthcare providers, there are some healthcare providers who genuinely want to help the community, who want to learn from the community, but their hands are tied because the laws don't allow them or restricts them really, in providing care for them. There are a lot of language barriers also which are present. So, and I want to also specifically talk about, since we're speaking of reproduction, in a state like Australia, where you have only 2 crore people as compared to 130 plus crore in India, they have registered 250 births by trans men. I wonder if we have even a single example from India, where a trans man has given birth. It would be news, I'm sure. So, and they have started training their physicians and gynecologists and midwives on gender neutral birthing terminologies, like chest feeding instead of breastfeeding, like calling them birthing person instead of mother or pregnant woman. In India, we don't have that conversation. We don't even, unfortunately in India, we are still stuck at providing dignified labor room practices to cis-het women. If you visit a labor room, I don't know how many of you have visited a labor room, but then physical violence takes place in the labor room. Women are slapped, they are abused, the abdomens are pushed, and this is what I witnessed myself as a medical student, and it was pathetic and it was normalized. It just seeps so much into them that they don't feel even bad about doing that. It's like the right thing to stand on the top of the abdomen of a woman and give a push so that the baby can come out faster. Unfortunately, we are still in those ages as compared to other places where we are speaking about gender neutral terms and so on. Even when many people want to help, another issue which they have are the infrastructural and the protocol barriers. They maybe as a person want to help you, but the institutes don't support them. You have nowadays very corporatization of the medical care with Fortis, Apollo and all these hospitals coming. And they don't want to be known as the places where transgender persons come, because that would affect other clients. Just like some hotels won't allow you because they don't want to be seen as places where people from the Hijra community also go, right? So these are the issues that they have. Then there are barriers in terms of writing the gender on the medical records, whether you put the legal name or the name which is there on the Aadhaar card. In terms of infrastructural barriers like no gender neutral washrooms or wards being there, though it's present in the Trans Act that all hospitals should provide indoor and outdoor patients facilities to the trans persons. Next, please. I'll not be speaking much on menstruation. I'm sure my co-panelist will do that. So these are some of the places where healthcare provisions interact with us and discriminate against us, like cancer screenings, PrEP, PEP, contraception, and so on. Next. Um, Next, please. So when it comes to menstruation, I'll give it to my co-panelist, who is a trans man, to speak more on it, on what are the challenges. But then it's something which is considered to be a women's thing, and unfortunately dealt with by gynecologists who are now mostly women. And this is a phenomenon which has happened in India, that now only women take up gynecology and men are afraid to take gynecology. Whereas 20 or 25 years back, nearly 50% of gynecologists in India were men. So I don't know what has happened in these. Maybe we need an anthropological study on this as to why now men are not taking up gynecology. And it has really become only a women's world over there. Next. So when it comes to breast cancer screening, as I said, it's also going to be a little educative, because I also want you to understand need for your own bodies and also take these messages to people who are not part of this conference. So when it comes to breast cancer screening amongst the trans men, remember, if the trans men have not undergone a chest reconstruction surgery and they have the breast, then they have the same risk of breast cancer as cis-het women, and they should undergo a breast cancer's annual mammography after the age of 50 years till the age of 65. And if they are taking testosterone, then that decreases the risk of breast cancer. So, but we don't have good enough studies to say whether it decreases to the risk that you don't require screening. And even if you have undergone a chest reconstruction surgery, remember this, that they cannot remove 100% of the breast tissue. And even if some breast tissue is there, it can turn cancerous, and therefore ideally you should undergo breast cancer screening after the age of 50 years. Remember this, that breasts are not only present in men, but women, but also in men. So cis-het men also get breast cancer, and they should also undergo screening. Yeah, next. So when it comes to the cervical cancer screening, I'm sure most of the cis-het women are familiar with the pap smear test, which is being done every 3 years after the age of 21 years till the age of 65, or till you decide that, okay, now I've done enough of my health. So many of the trans men do not undergo a bottom surgery, or kind of what we call as a hysterectomy, in which the cervix is also removed. And if there is a cervix, there can be a cervical cancer. So all trans men who have cervix should undergo pap smear screening also. Next. When it comes to the prostate cancer screening, now this is for trans women. So even if you undergo some kind of a genital reconstruction surgery, remember this, that only the testes are removed and not the prostate. So if you have a prostate, you are likely to get prostate cancer. Of course, when you use anti-androgens, or if you use 5-alpha reductase drugs, then that decreases your risk of prostate cancer, because it shrinks the prostate but does not take away it completely, and therefore annual prostate cancer screening is required after the age of 60 years. Next, when it comes to HIV prevention in trans people, this has been spoken a lot, so I think I'll skip this. But remember this, that irrespective of the kind of sex you have, even if it's a sex between two lesbian women, there is a risk of HIV transmission, and you therefore take precautions. Next. I think it's very important that now NACO introduces PrEP and PEP, especially for the key populations, including MSM and trans persons. And PrEP is something, pre-exposure prophylaxis, in terms of you take ART drugs or antiretrovirals before you get HIV. Right? Or before you get exposed to an HIV positive person. So whenever you think you are likely to be in situations where you have more unprotected sex, or where the barrier is likely to fail, in those situations you can start taking PrEP, and you can take it for as long as you want, and then you can stop it also, unlike ART, which once started cannot be stopped. This is available with some private providers in India, including some of the health-based NGOs, but not part of the government setup, and this is what we need to advocate. So I think one of the advocacies out of this conference could be advocating for PrEP for the key populations. Next. Similarly, when it comes to post-exposure prophylaxis, this is something which is reserved for the healthcare workers. Currently in our guidelines, only healthcare workers who come across an HIV-infected person's exposure are supposed to get PrEP. But then it's important that we also provide this to the key populations at least, and then later on to everyone in the general population. So what is PrEP is basically post-exposure prophylaxis. So suppose you had an unprotected sex and you know that that person is HIV positive or any other form of exposure, then you take antiretroviral drugs for 4 weeks. And that drastically decreases the chance of contracting HIV. Next. Then when it comes to treatment of STI, remember that whatever form of sex you are having, you can get STIs. You can also get STIs even after using condoms, because they only cover the genitalia and not the skin. And when it comes to STI, you can also have skin to skin transmitted STI. You can have mucosa to mucosa transmitted STI. So take care of that aspect. And when it comes to key population, the current NACO guidelines mention that you should take these antibiotics every 3 months. But unfortunately, the knowledge of this with our sex workers kin is very, very less. So this needs to be propagated more so that they can take advantage of this guideline in NACO. Next, please. This is something very important, that when it comes to contraception, this is what we'll have to demand, because the healthcare workers considered that you are asexual beings, you are not capable of producing, and therefore why would a trans woman or man need contraception? I mean, aren't they infertile because of the HRT which they are taking, or they must have undergone some form of surgery, and they must be infertile kind of person. So remember this, that HRT does not necessarily make you infertile. Even if you are on testosterone, even if you are on anti-androgens or estrogen, you may still be fertile and therefore need contraception. Also, it's wrong to assume that all trans persons are cis. We have a lot of trans persons, for example, trans women who are lesbians and trans men who are gay, and they may have a penetrative sex, and therefore it's important to also educate your friendly healthcare workers that trans persons do need contraception. So talk about that. Ask them if they have a need of knowledge of contraceptive methods, or if they need any contraceptive methods. So this is a conversation that we'll have to start with the healthcare workers. Next. So I'll summarize with what actions is needed. So definitely we all agree that we need to reform medical education, but let's not lose our focus on reforming other educations also. Generally our focus is only on legal and medical education. You know, I was discussing with Kanmani yesterday that why not fashion designing also need reform. When it comes to designing clothes for trans persons, or lingerie or footwear for trans persons. Why the chartered accountants don't need to reform? Because aren't our taxes also for males and females separate, slabs being present? So we need reform everywhere, and not just in the schools, law colleges or medical or nursing colleges. We need to amend the existing laws. We need to keep making noise that the Surrogacy bill and the ART bill and the Trans Act do not provide for the reproductive justice for the trans persons, and they need change. Until unless we demand that, they are not going to change it. Second is the guidelines have to become trans inclusive everywhere, including, for example, the cancer screening guidelines. Next, please. We need to demand for changes in the pattern of birth certification. Right now, within 21 days of birth, one has to register. And during that time, you can't really decide, for example, whether an intersex child is a male child or a female child. How do they register? Many a times they register as a male child in that case, you know. So we need to demand that there should be a provision for intersex children in the birth certificates also. This is very important, and some work on this has been done by Safe Access, that is demanding dual records, especially in the healthcare setup. So suppose if I go as a trans woman to a healthcare setup and they don't know that I have a prostate, how are they going to offer me prostate cancer screening? So we ask for dual records where you know, your sex, biological sex is mentioned and your gender is also mentioned, so that the healthcare worker knows what kind of anatomy you may have. But again, it's very difficult to assume your anatomy, and therefore, next we also talk about an body checklist or an organ checklist. Like, do you have an ovary? Do you have a uterus? Do you have a prostate? And then accordingly, the services will be provided to you. It's very important to tell our providers that sex and gender are different, and therefore do not confabulate between them. That gender identity and sexual orientation are different stuff, so don't assume that all trans persons are heterosexual. Next, and this should be my last slide, which says that it's very important to reiterate that all trans people are neither asexual nor hypersexual. And who gets to define what is hypersexual? You know, what may be hypersexual for you may be normal for me. Also, trans people may want to marry, they may want to have the biological children, and the medical sciences need to help them with that. That's the right of the clients. And the trans people may also need contraception, and therefore we need those kind of conversations in our healthcare setup, and not just around gender affirmation surgery. Yeah, that should be the last slide. And this is the message that is there for all the healthcare workers, and which we can take it to them, that ask, don't assume. Ask me about my body, ask me about what I want, and ask me about what are my aspirations. Don't just assume that. Thank you.